Louisville has a problem with health. Out of the 50 biggest cities in the US, Louisville comes in last for overall health and fitness. Now, this isn't a simple issue, but here at Insider Louisville, we're going to shine a light on what's making our city so unhealthy and show you what to do. The issue of health involves a bunch of different things, but in order to improve our city, we need to focus in on just a few. In Louisville, a lot of it comes down to diet, smoking, and fitness. Now, diet has been a problem in Louisville in many ways since the early 1900s, but obesity especially has been a problem since the 60s.
Back in the 1950s and 60s, there were lots of small grocery stores in the neighborhoods, and they were owned by people in the neighborhoods. And the consolidation of the grocery stores also contributed to this, so we had a lot of mom and pops that can no longer survive.
New Roots is an organization in Louisville that provides fresh produce to places without grocery stores, sometimes called food deserts. For Karen, health issues come down to access. That's the main thing that affects diet in Louisville.
So we have this terrible situation in a lot of our urban centers, but also in rural areas where we have flight of grocery stores. So it creates a situation where a lot of people call it food desert. Some people call it food swamps because the fact is there is something there in the neighborhood, but what's there is fast food.
The issue of smoking is a whole other deal. More people in general smoke in the South and Midwest because that's where the tobacco is grown. Half of the country's tobacco farms are located in Kentucky specifically, and that has a big effect on the cultural attitude around smoking. But more importantly, Kentucky has one of the lowest taxes on cigarettes in the country. Here, a $5 pack of cigarettes will cost you $5.60, but in New York, the same pack would cost you $9.35. And taxes do have an impact. In 2015, Kentucky had the highest rate of smoking, while New York had one of the lowest. Finally, fitness.
We have a history of that. It did not occur in a single year or generation. It's taken us a long time to get here. So we have many opportunities to improve our health around the country.
Physical fitness is a focus of the YMCA, but people like Steve Tarver and Karen Chavis agree that fitness is connected to a lot of different things.
So as we look more closely at public health, number one, we got introduced to the important relationship that education has. So we understand that we will not have a healthy community unless we have a well-educated community.
So I think fitness and diet are both important, and I don't mean to diminish one by focusing on another, but I really do think the diet is key.
All of these people say that diet is step one and fitness is step two.